Yeah, we are live now, ma'am. Good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar, Menopause Journey, Awareness, Acceptance and Action, on the occasion of World Menopause Day. So this webinar is hosted by Chennai Menopause Society, World Association for Sexual Health, and Oxy. So it's my privilege to introduce the convener of today's webinar, Dr. Jairani Kamaraj ma'am. Ma'am is the Senior Consultant of Reproductive Medicine and Director of Akash Fertility Center and Hospital, Chennai, South Zone Coordinator of No to Wow Committee, President-elect of TAPISA, President of Oxy in 2023, Joint Secretary of TNFOG, and Advisory Council Member of World Association for Sexual Health. I welcome you, ma'am, and I hand the session to you.
Thank you, Sahiti. Thank you for your nice introduction. Good evening to one and all. A very warm welcome on behalf of Chennai Menopause Society, World Association for Sexual Health, and my dear Oxy. I welcome all the senior faculties here, and a very special welcome to Chief Guest, Dr. Faisal, and the guest of honor, Dr. Ragini Madam and Dr. Anita, and the office bearers of Chennai Menopause Society, President Dr. Premlata Madam, Secretary Dr. Deepa, Oxy President Dr. Sampath Kumari, President Secretary Meena, senior faculties who have joined with us. A very warm welcome to one and all. So this is a very special international webinar in connection with the Menopause International Menopause Day. Today we have come together to shed light on a very important stage of women's life that a woman experiences, and yet she's often surrounded by a lot of silence, lot of misunderstandings. That is the menopause. So we are here this day to not just about the awareness, but also about the empowerment and creating an education and empathy towards the women regarding the menopause. So each year on October 18th, way from 2009, we celebrate this day as an International Women's Menopause Day. So where we'll observe very many themes to improve the women's health regarding the menopause. And every year we will have a global theme that reminds us the importance of supporting the women through the natural transition. Though we don't say it is a problem, it is actually a natural transition which we have to go make the women go through in a nicest way, because she goes through a transition of physical, mental, emotional, social, many transitions happens at this stage of menopause. So we have all the gynecologists here. We have a great responsibility to look into this women's life, which is a very important part. That's the menopause. So have here a great privilege. We have the esteemed chief guest, Dr. Faisal, who is the president of World Association for Sexual Health and the past FIGO vice president, as a chief guest. And I'm very happy and privileged to have with us the guest of honor, Dr. Anita Shah. Madam is the president of the Indian Menopause Society and a very dynamic Secretary General of Indian Menopause Society, Dr. Ragini Agarwal. And with me, our senior Chennai Menopause office bearers and Oxy office bearers here. And we welcome all the faculties who have joined with us as an expert, way from the dietitian, Dr. Daphne, pulmonologist and sleep specialist, Dr. Jayaraman sir, and the fitness person, Dr. Kani, and mental health, Dr. Shweta. So we have here with us a very senior IMS treasurer, Dr. Hepzibah Madam, who will be sharing her experiences with ours related to the women's menopausal health. So as we begin, we remember that menopause is not an end, but a new beginning in a woman's life, a time for our renewal, reflection, and reclaiming on strength and identity. So together, let's all break the myths and open a wide conversation and promote a positive relationship, positive health approach, positive health care for the women who suffers through menopause. So I welcome one and all the delegates and also all the senior faculties who joined here. We welcome you one and all. So we start this program with the inauguration. So generally the inauguration, we start with a prayer song. We have the prayer song which we owe to our Tamil Thai God, the Tamil goddess. We wish start all our program with the wishes and the blessings of Tamil goddess. Over to Sahiti. So now we'll have the traditional Kuttuvilakku, which is always we see as an Indian culture, which symbolizes knowledge, positivity, and enlightenment. And today, in this International Menopause Day, the lighting of the lamp carries a special meaning that it represents the light of awareness we aim to spread about the women's health, her strength, and her resilience. So we'll start with the lighting of Kuttuvilakku. So we'll move on to the inaugural function. May I have the greatest pleasure and honor in welcoming the chief guest, Dr. Faisal El from Lebanon. Sir is the present uh, World Association Sexual Health President. Sir is the Associate Professor of Clinical OBGYN, Sexual Health and Public Health Practice, and the Director of the Women Integrated Sexual Health WISH Program, the Department of OBGYN of he's a faculty in American University of Beirut Medical Center and a faculty of Health Sciences of AUB. Sir is the member of STAGE WHO, member of the board of directors of Gushamath Institute. He is the past vice president of International Federation of Gynecology and Obstetrics, that's our FIGO, and he's the chair of the Arab Women Health Group, Federation of Arab Gynecological OBGYN Society. He is the advisor to UNFPA and WHO, for author of very many research articles and book chapters and media articles covering women's reproductive sexual health, displaced population, and survivors of violence. Sir is a very dynamic person who works for the women's health in the Mediterranean area and has a lot of work in the international level. We welcome you, sir. I think Sir is just, he'll be joining a little late because he has some condolence, which he's going for the funeral, and he'll join little later. So we have the honor to have our guest of honor, Dr. Anita Shah and Dr. Ragini Agarwal, madam. Anita Shah, madam, is on the flight. She just messaged me. She'll be landing sometime. So immediately after landing, she will address her. And we have the Secretary General of IMS, Dr. Ragini Agarwal, here. Madam is the founder president of Association of OBGYN of Haryana OBGYN Society, and she is the director of the AA Dermascience, a complete clinic for women's health, Gurgaon, and a fellow of the clinical gynec endoscopy, graduated from UK, aesthetic functional regenerative gynecologist, and a female sexual health specialist. And she's the president of the Indian Society of Aesthetic and Regenerative Gynecology, that's INSARG, president of the Indian Academy of Cosmetic Dermatology and Gynecology, founder presidents of NIGF 2022, general secretary of IMS from 2024 onwards, vice president of FOXY 2020, founder, chapter convener of AMWY Gorgan, WHO GOA Foxy Adolescent Health Trainer of 2026. Madam is the best committee chairperson of IMS 2022, IMS President
रहने
Appreciation
दो,
Award
रहने दो.
she got from 22-23 and got lot of awards like Javeri Award for the ICOG Symposium, International President Award, Appreciation Award, IMA State President Appreciation Award, National President Award, and she has conducted very many orations and keynotes in many of the national and the international forums, and she has been awarded the PJ Abdul Kalam Award for Academic Excellence, and her keen interest is to the community medicine, public health education, and women's quality of life and the medico legal aspects. And she has authored very many publications, and she has done a lot of
Dr.
social work in the
Jairani,
rural and maternal healthcare and projected very many work for the women related to the community. So, Madam, we welcome you. And today, being the International Menopause Day, we would like to have your words of wisdom, Madam.
thank you so much, Dr. Jairani, for your kind introduction and invitation to a society which is so close to my heart. Chennai is always and always with me because my son has graduated from there, and from that day Chennai has a very special relation. Then we have so many friends, you, Dr. Premlata, Dr. Shanti Guna Singh, Dr. Hepsi, and it's an honor to be part of this special webinar on a international menopause day with three great societies: OXY, Women World Association of Sexual Health, and Chennai Menopause Society. Thank you so much. Vannakam to one and all. And I just want to say two things on this World Menopause Day, that menopause is an eternal truth in our life. It is always there, whether we marry, we have a child or not, menopause is going to come to each and every woman. So we should not expect others to make us happy. This empty nest syndrome, and these problems, I think all can go away if we are really learn to enjoy our own company. My only this message is to all of you on this day. With the holistic approach to the menopause, make yourself strong, happy, independent, and if we follow the philosophy of the Indian Menopause Society, you have to be sexy, naughty, and healthy till 100. So thank you so much, Dr. Jairani. And especially, I'm so happy you're not talking about the hot flashes, mental fog, but you're talking a very, very important thing. That is sexual health. For people think of a 50-year-old woman, oh my God, why we talk about the sex at that age? The time has changing. People are changing. Even at 50, 60, people are getting married. But it's important to talk about the sexual health because it is as important as physical and mental health. So congratulations to you, Jairani, Chennai Menopause Society President, Dr. Premlata, Dr. Meena, and Dr. Sampath Kumari, and everyone who are here to learn something new. And I'm so happy that our chief guest is President of World Association of Sexual Health. So please carry on. Over to you. Thank you so much.
Thank you, Madam. Thank you so much. I request our President, Chennai Menopause Society, Dr. Premlata, Madam, for a few words of wishes for us, ma'am.
Thank you. It gives me great pleasure today because today being the World Menopause Day, and we are able to host a webinar, international webinar, speaking with the chief guest. He's president of the sexual health, and we are able to do this webinar along with OXY and World Association of Sexual Health. Really, we all know as menopause is not a stage or an end of youth. It is a beginning of a newer transition, and it should be always a healthy, or women should be they should find confidence in the menopausal period, and there should be a healthy transition period in order to tide over all the crises and all the problems, both physical and mental health, they should be able to succeed in the menopausal age group. As clinicians, we should be able to disseminate knowledge and do public awareness program so that we educate all the midlife women and clinicians per se, so to take interest upon this midlife women, and so that they have a good, peaceful and healthy menopausal transition period. So today we are happy that we are having an international speaker. He is the president of the World Sexual Health. And I'm happy that Dr. Ragini Agrawal and Dr. Anita Shah have joined us today from the Indian Menopause Society. And this program will be definitely a of great interest to all the people who have joined here, and will be able to broaden the knowledge on the menopause and the women's health. Thank you, Dr.
Thank you, madam. Thank you for your kind words. May I have a few words from our president, Dr. Sampath Kumari?
Good evening, Jairani. Really,
evening.
thanks for Jairani to unite Menopause Society, our Oxy, and the World Sexual Association. So you have called the president itself for our as a chief guest, so he may be joining in future. Our Menopause Society president, Dr. Anita, and secretary, Dr. Ragini. Dr. Ragini, dhanyavad for the word vanakkam. Anyway, so Jairani is always good in organizing the webinar and in-person CME. So today afternoon we had from Oxy, we celebrated the Menopause Day and our Diwali function. So it is very nice to have that webinar, as Premlata madam told, on the important day. Thank you, Jairani, and I wish all the best for the success of this webinar. Thank you.
Thank you, Sampath. Thank you so much. May I have a few words from Treasurer of IMS, Dr. Hepzibah, madam?
Oxygen. Okay. So it really gives me great pleasure to address you all, dear friends, on a Menopause Day. We are celebrating. It's a wonderful webinar, and the theme is akin to the International Menopause Day theme. That's a lifestyle modification. So you've nicely brought in the diet and the exercise and the sleep disturbance and the sexual dysfunction. Everything is addressed in the webinar. It's great you have brought in all the IMS office bearers, the WAS president and Oxy office bearers, and it will be, I'm sure at the end of this day, it's going to be a good output, take-home messages. All the delegates will be having it. Thank you for involving me. Thank you so much. And congratulations to you.
Thank you, ma'am. Thank you so much for your kind words. I think Anita madam has landed, but she's just deboarding from the flight. And she said that once she's in a position to talk, she will message. By that time, madam will join, so that we'll introduce her by that time. Now we'll move on to the academics. I have the great pleasure and honor in welcoming the chairperson for the second session, because we are just waiting for the president of WAS, because he is in a funeral. That once he completes, he'll join. So I think we will start with the panel first, the second topic of the day, that is the expert panel. So I have the great privilege and honor to welcome and introduce our president, Oxy.
Jairani, you start with the panel. Don't waste the time. My Hepzibah madam is there. You are there. You introduce the panelist and start. Me and Meena is here only.
Yeah, you can introduce ourselves, madam. you have to introduce
yes,
ourselves.
definitely. We will
So
introduce.
over to you, Sampath and Meena. Meena is the dynamic secretary of our Oxy. Very dynamic to work a lot of activities in Oxy, and a very budding urogynecology specialist, over 25 years of experience. And she is the associate professor of this Chengalpat Medical College, and a very active person working related to the community and for the women's health. We welcome you, the president and secretary of Oxy, to be the chairpersons for this session.
Meena, I will introduce Jairani and Hepzibah madam. The panelists
Okay,
we introduce. Okay, Dr. Jairani. Dr. Jairani is the senior consultant of reproductive medicine, infertility, and sexual medicine, and she is the director of Akash Fertility Center and she is now the committee chair elect for the WOW committee, and she is the president elect for TAPISAR. She was president of Oxy 2023 and joint secretary of TNFOG, advisory council member of WAS, and she has many medals and awards to her credit. One minute.
Enough, Sambat. The mic says
One
enough.
minute.
Mic
The
says enough.
Ramamne,
You go to
she has,
Epsiba, madam. You introduce Epsiba, madam.
yes, no, I lost the connection. That's the reason. Okay, she has many medals and awards, and she is a good, what to tell, Oxy member and past Oxy president. And she got the best society award. There are many things to tell about Dr. Jairani. Now we will go to Dr. Epsiba, madam. Dr. Epsiba madam was our past president of the Oxy and past president of Chennai Menopause Society and treasurer of IMS. And she has received 2 consecutive year Best Society Award during CMS presidentship. And she is the PhD guide. Madam is herself is a PhD. She is one of the PhD holder in Chennai and a PhD guide for SRMC students and published many papers. Madam has many awards. If you are want to tell about the awards of the Epsiba madam, we will take full day. She has got all awards from IMS, IMA, and Foxy, Oxy,
Yes,
everything she is
Sambat,
having.
thank
And
you.
1 minute, and she has given the best paper that Epsiba madam is for TNFOG best paper award in the annual conference. It was distributed by Dr. Epsiba. Thank you, madam.
Thank you.
Meena, introduce the panelist.
Yes, ma'am. So it gives immense pleasure to be a part of this wonderful session on the World Menopause Day. And we have expert panelist Dr. S. Jayaraman sir, who's a senior consultant pulmonologist from MGM Healthcare, Billroth Apollo First Med Hospital, Chennai, Sri Jayam Chest and Sleep Clinic, Chennai, special interest in interventional pulmonology and sleep disordered breathing, Chairperson MGM Academic, Secretary IMA Academic of Medical Specialties, IMA TNS State Branch. This is one of the most important topics today as well. And Dr. Daphne Lovesley, who is a registered clinical dietitian with over 28 years of experience in clinical nutrition. She serves as the director of the Apollo Clinical Nutrition and Dietetics Internship Program and played a pivotal role in establishing the Nutrition Steering Committee of Apollo Hospitals. She holds a PhD in clinical nutrition with a specialization in liver transplant nutrition and has completed the profession in clinical research. Dr. Daphne is actively involved in academic governance as a Board of Studies member in nutrition at Women's Christian College, Manipal University, Avinash Lingam Institute for Home Science and Higher Education for Women, Coimbatore. Dr. Daphne is the General Secretary of Indian Society of Parenteral and Enteral Nutrition, and she also contributes to the Malnutrition Committee, has more publications to her credit, and she has got the CMO Asia Award 2017 for Best Quality Initiative in Healthcare and the Apollo Clinical Excellence Award, and also the Best of the Best Award in International Nutrition Survey conducted in 2011, competing among 183 hospitals globally to her credit. And this is also one of the most important topics. Next. We have Dr. Shweta Raghavan, who's a senior consultant psychiatrist, Atma Mind Care Hospital, Kodambakkam, Chennai, with 15 years of clinical experience in the field of mental health. She aims to bring in a judgment-free world where people are allowed to be themselves without fear of being ridiculed. She completed undergraduate medical curriculum at PSG Coimbatore, later completed postgraduate in psychiatry at Madras Medical College. Her motto in life is the purpose of life is a life of purpose. Excellent, madam. Next, now we welcome Dr. R. Kani, who's a doctorate in sports coach. Over to the expert moderators, Hepsiba madam and Jairani ma'am, to take over the session.
Thank you, Meena. Thank you for your kind introduction, and thank you, Sampath, for the
Thank you,
introduction. So
and
we
the
are
panel is
starting.
on menopause 360-degree, which is very
holistic.
different topic, holistic lifestyle approach.
Yeah,
How
it's a
we have to
holistic
lead our life with the menopause.
Yeah,
yes, thank you, ma'am.
that's it. So, thank you, Meena. So every year we celebrate this International Menopause Day. Can I have my presentation to be shared, Sahiti? Can you see my slides, Sahiti?
Yes, ma'am.
Yes, ma'am.
Okay. Right. So every year we have a theme on this International Menopause Day. So it is as it is, as rightly pointed out by our General Secretary of IMS, talking about hot flushes, mood swings, this and that, all the negative aspects you go through in the menopause, which scares the women. So this year, the International, Menopause Society has made a very positive approach of shifting this type of a conversation into a more positive way of a well-being, a positive way how you go through the menopause in a positive way, that is to a well-being. So we were all talking about the symptoms of the menopause, how it's affect the women, and it creates a lot of negativity about the menopause and scaring the women. But you have to shift this type of a symptoms into a positive way, that is to empower the women from the silence to empowerment. So this year, the theme is beautifully coined as the lifestyle medicine, and it asks a very simple and a very powerful question to every woman who go through a perimenopause and a menopause: what you do every day, what you eat, how you sleep, how you exercise, what you make your way in a relationship, how you have to go through. Everything is comes under this lifestyle, lifestyle medicine, which is a very important one. And they have coined a beautiful pillars, the 6 pillars, which coin the lifestyle of any women at the menopause. The first being the healthy eating, the second being the mental health well-being, and the healthy relationship which you have your partners or your spouse or all the one at in your society, and how you have yourself in a physical activity of going through this menopause, and how to have a minimal substances abuse, because we are now moving into an westernization. Smoking, alcoholism, everything is nowadays very commonly seen even in our Indian setup. So we all should be aware of this harmful substances effect also. So we have to have a positive thinking of how to minimize it. And very important is the sleep. So these are all the one symptoms that we have all gone through this menopause, but now we have a solution for that, how you can do daily to improve it. So the 6 pillars: healthy eating, mental being, everything is a very important campaign. So this year, the whole menopause day, as well as the whole year, we have to think of all these lifestyle pillars of how we can have a healthy eating, how to choose your food which can support your heart, your bone, your mind, your body, your strength, and how you can come out of the mental stress, and how you can do your mindfulness, and how you can get an improvement in your emotional support and healthy relationship, about your communication, social support, and all the physical activity which will help you to improve your strength, flexibility, your resilience, and your strong, powerful way of going through this menopausal difficulties, and minimizing the harmful substances, and improve the quality of the sleep, and thereby improving your sleep hygiene. So we have here now with us the experts who will be talking about all these things what we go through. This is actually, I've called up these experts to say simply what as a gynecologist should talk to the patient. So when a patient come with a menopause, we need not, they come with the symptoms, but you give him a solution of how they have to live, what they have to eat, what they have to do the physical activity. This will make us more empowered and educative to know about these things, so that they will be building up in a better way. So definitely this is matter, because most of the symptoms of women silently go through, which they think that is a normal aging. But there is a way that you can go through it in a better way, in a good lifestyle changes and support, which will make it to go through this journey in a very active and a very smoother way. So we have here the healthcare system people to make it a very practical approach, that on your plate what you want to eat, on your feet how you have to walk to improve your strength training in all this, and how you can have your mind with a stress reduction and social connection, and how you can have a good sleep routine, which will be definitely have a better improvement in the quality of the life, so that she lives through the menopause with the reduced risk of osteoporosis, heart disease, depression, and frailty. So we have here to speak on this on an expert way. I hand over to Dr. Hepzibah Madam to take up the dietitian's questions. to Dr. Daphne Lowsley.
Yeah. Good evening, one and all. Can I have the next slide?
Yes, ma'am.
Yeah. Daphne, can you tell me what key nutrients should menopausal women prioritize to maintain bone and heart health?
That's a very interesting question. Hope I'm audible.
Yeah.
You're audible.
Audible, and
Okay.
we can see you also.
Okay. Really happy to be a part of this webinar. Thank you for the invite, Dr. Jairani. Especially during menopause, there is a hormonal change that the women undergoes. All of you experts are aware. As there is a decline in estrogen, there is a significant impact on the bone health and cardiovascular health. As a dietitian, what would I suggest? Basically, when we talk about bone health, the key components are calcium, vitamin D, and your magnesium, vitamin K, and your protein. Calcium, all of us know that we do take calcium-rich foods like fish or seafoods, green leafy vegetables, and during menopause, the amount of calcium that is required is increased. So around 1,200 milligrams per day. So it becomes a little challenging task for the a layperson to achieve these targets, and that is one of the reasons why supplements are also given. When we look at the calcium sources, basically low-fat dairy products can be taken. If you are a non-vegetarian, you can always emphasize on seafoods, especially fish. And vegetarians, leafy vegetable is a very good source. And, when we look at our Indian setting, ragi is one important cereal that we use, which is a very rich source of calcium. Moving on to vitamin D. Vitamin D also needs to be prioritized because it is required for absorption of calcium, and vitamin D, you get it from fatty fishes. And all of us know that sunlight is a source where inactive vitamin D gets converted into active vitamin D. But how much of exposure do we really do every day? So that becomes a real challenge. So seafoods, egg yolk is one good source, and a handful of nut. And moving on to cardiovascular issues. This is very common as the women moves on to menopause, because as estrogen level comes down, the men and women differences go off, and cardiovascular risk also increases. When we talk about diet, maintaining weight is very important. So ensure to advise them to minimize on carbohydrates that they take apart from the fat. So carbohydrate doesn't mean you'll have to totally stop carbohydrates. You can always tell them to cut down and avoid simple carbohydrates like sugars, sweets, and low-fat diet is better. Always suggest them a combination of oil or healthy fats. Healthy fats are nothing but, monounsaturated fatty foods like the oils that we generally use. In South India, we use gingerly oil, groundnut oil. That comes in very handy because it has around 40 to 45% of monounsaturated fats. Handful of nut. It doesn't mean that you have to advise only almonds. A handful of peanut is fine. So a combination of all this. Apart from that, high fiber, which we generally, tend to minimize. When you talk to your patients, they will tell you they'll have a very minimal portion of vegetable. Always tell them half a plate of veggie is important so that they feel more filling, and it helps to reduce the LDL, and it improves HDL, and it helps to maintain weight also. So all these are very important. One underlying, very important thing that needs to be underlined is the omega-3 fats, which we get it from fish. If you're non-vegetarian, fish is perfectly okay every day or at least twice a week. And if they are vegetarians, they can always have flaxseed or chia seeds, walnuts. 30 grams is the limit that is advocated. Every day, if they could have 2 tablespoons of it, they should be able to reduce the inflammation of the body. That will enhance, improve on insulin resistance, which in turn helps to maintain their body weight.
Thank you, Dr. Taffin. It was a wonderful thing. Can you tell us how can a diet influence hot flushes, mood, weight management during menopause?
Yeah, hot flushes is a very common symptom that we see. And generally, with regard to diet, phytoestrogen is one component which is advocated, wherein you get it from soy protein. Soybean is one thing which has a contradictory effect also. There's research to prove that phytoestrogen from soy, if 40 milligram is provided, it helps to reduce hot flushes, it helps to improve mood as well as sleep pattern. And, this is a recent research in 22 which has come out. So apart from that, you can advocate flaxseed, you can advocate chickpeas. All these will help to minimize hot flashes, and omega-3 fats help to improve on the mood of the person. And weight management by itself is a topic to be spoken, because this is one important component which most of the menopausal women undergo, because their BMR goes down, but they don't become active or they don't reduce on the food that they eat. So emphasis has to be placed on portion control, increasing on their fiber content in the food, and specific attention to protein, because protein for a postmenopausal women is very, very important, which we really neglect. Protein per se, it can be egg protein, fish, chicken, red meat to be avoided, but ensure that they have quarter plate of protein, quarter plate of carbohydrate, half plate of vegetable. This will be a simple thing that you can advise, and it is not a thali plate, it is a 9-inch plate. Portion control is mandatory, and always advocate a Mediterranean diet, which emphasizes on eating fish, high fiber foods, and a healthy fat.
Yeah. This intermittent fasting is safe and effective for women in this stage of life.
Intermittent fasting is a controversial topic, but if it is used in a short term, yes, of course, it is impactful. It helps to make the person lose weight. It helps to reduce sugar, but it has to be practiced with consensus with a doctor, clinician, because long-term effects are not studied, and long-term it is difficult to follow. And intermittent fasting does not speak about what to eat. It is a time-bound eating. What I normally advocate is 12:12 fasting instead of 16:8, which becomes very difficult for people to follow in a long run. Ensure that they eat their dinner as early as 7 to 8 p.m., not later than that. If that happens with the appropriate balanced diet, it becomes very easy to, help them live a healthy life.
I think this part, you have already discussed the importance of soya. Can I have the next slide? Can you suggest one simple one-day meal pattern which is ideal for menopause women?
Okay, so one-day meal plan per se, a simple thing that you should always have in mind is a low-fat milk and milk product, at least 2 glasses of milk in your meal plan. So morning, a cup of milk or a bit of tea or coffee. Next comes your breakfast. Always emphasize on millets like ragi, because it is a rich source of calcium, or oatmeal, which is rich in fiber. Then emphasize on portion control. And for your lunch, whenever we talk about lunch, make sure half a plate is filled with vegetable, especially green leafy vegetable. And Indian setting, the drumstick comes in very, very handy. And a cup of curd, which is rich in probiotics, which is good for the gut, because gut health also relates to postmenopausal symptoms. And early dinner, maybe a portion controlled dinner. It can be, based with dal, because dal is also very important to ensure that the person gets adequate protein, apart from non-vegetarian sources, if in case they are non-vegetarian. And low-income group, this is what we see on a regular basis. So low-income group women, if you look at, we can emphasize on ragi as a basic cereal for them. Green leafy vegetables will give them adequate calcium and fiber, and emphasize on fruits which are good to give them adequate potassium, like bananas, guavas, which are easy to procure, because we can't talk too much on high funda items. Simple food, even if it is rice, ragi, or oatmeal as a combination, is good for them because they get their energy. And locally available foods is what we should advocate when we talk about low income group.
Can I have the next slide?
Yes, ma'am.
Whether to avoid certain things. What are the foods to avoid? This
Foods
midlife
to
woman.
avoid per se, as you see it here, caffeine and alcohol, yes, of course, it's a big no. 3S is what I always tell: saturated fats, sugars, and salt. So processed food can be avoided. That will help them to maintain their blood pressure, which in turn helps to keep the heart healthy. Next comes your saturated fat. So butter, ghee, vanaspati can be avoided. Instead, use a combination of oil and a handful of nut every day, which will take care of the fat requirement. And sugars, the simple sugars and sweets, to be completely avoided, because most of our Indian women do not exercise a lot. They are more sedentary. Unless they cut down on simple carbs in their diet, it becomes very challenging for them to maintain their weight. So 3S to be limited or avoided.
Okay, can I have the next slide? This also, I think you have discussed with that. No?
Yes,
The
of course,
sodium,
there
yeah.
are controversies with that, but it is really advocated that soy products can be taken because it does not harm the person. There is no risk of breast cancer. There are researches which have proved that.
The
So
Japanese
anything that
eat
we
a lot
take,
of soya, no? Japanese. And the
yes,
longevity
of
is
course,
more, and they don't have
yes,
all the symptoms.
exactly, as well as
Because we have not
whenever,
done a lot of evidence is lacking. That is the thing. Otherwise,
exactly,
I mean,
that's why we say it's moderation.
okay.
Anything
Can
in
you have the next
moderation will
slide?
not harm you.
Can you tell us the key takeaway points? Next slide, Pa. Next slide.
So, key takeaway points when you look at a diet: it is complex carbohydrate, which should be part of your meal plan. Ensure to take adequate amount of protein. As we talk about, menopause, a high protein. As you age, your protein intake also increases. At least 1 to 1.2 grams per kg body weight. So quarter plate is your protein. Next comes your vegetables and fruits, which gives you the antioxidants to help you maintain your system well, because it is rich in fiber. So it has an important impact on maintaining good heart health. And ensure to drink at least 2 liters of water every day, which is very, very important. And it has to be balanced together. So that's why we advocate more of a Mediterranean diet, wherein they talk a lot on fish as part of protein. So at least twice a week, ensure to have fish, because that has omega-3 fats as part of your meal plan.
Yeah, thank you so much. You have done a wonderful job and made it very crisp and clear. I think from today, we will take a proper diet so that we can have a healthy lifestyle. Thank you so much.
Thank
you, Daphne. Thank you, Daphne, for giving that as it is. The International Menopause Society has given a key points of 2 things regarding their fact sheets. So these fact sheets recommend For the bone health, you have to take 700 to 1200 milligram of calcium, and vitamin D around 400 to 1000 national units. And for the menopausal symptoms, they have given the diet rich in fruits and vegetables, which helps ease hot flushes and night sweats for many women. And also evidence on soy is mixed, and some find helpful where other finds a little effect. So that's the fact sheet of International Women, I mean, Menopause Society. And they have given the key point that the Mediterranean style diet with vegetable, fruit, whole grains, olive oils, nuts, and fish are the best one. And of course, you have to monitor the calcium rich food daily when you're taking, and cut off the ultra processed food, and also try to take more of plant based meals, which are health good for the heart, bone, and weight benefits. And you have given
Yeah.
everything so nicely, Daphne. Thank you so much for giving your expert. And on behalf of Chennai Menopause Society and our Roxy and Vas, I thank you. So now we'll go on to the next
Thank you.
topic, next part of the lifestyle. That's the fitness. So many a times, as a elderly women, we have a lot of questions to ask. Okay, well, a lot of issues comes to us because many times, because of this increasing osteoporosis, sarcopenia, everything happens in the women's life. What to do, how to keep yourself fit is a big question even for very many celebrities. So we have here with us Dr. Kani, who is a PhD in sports coaching, a first woman to have a judo PhD with us to talk on about the fitness. Welcome, Kani, and
Thank
we
you.
will be happy if you can answer many of our doubts and dilemmas. What, as a gynecologist, that we should talk to our patients. So many women fear exercise during menopause due to many times they have a joint pains, fatigue, which is mainly due to very many reasons like the hormones as well as the protein and the calcium gets lower. So what type of workouts do you recommend as safe and effective for the menopausal women, that is a women above 40, 45?
It's an honor to share insights on how exercise can empower women through the menopause transition. Many women hesitate to exercise during menopause because of joint pains, fatigue, or fear of injury. But movement is medicine. Gentle, low impact workouts such as brisk walking, swimming, cycling, yoga, or Pilates are safe and highly effective. These activities improve blood circulation, reduce stiffness, and ease hot flashes without straining joints. The key is to listen to your body. Exercise should energize, not exhaust.
So how does this strength training, because many a times my fitness person says, madam, instead of walking you have to do weekly 2 3 days strength training, which is very important for the joints and the muscles. Because many a times my mom at 80, she finds difficult to get up, she finds it difficult to sit and get up, because many times they have a difficulty in getting from the bed, and all these things happens as they get older. So how to have a proper strength training, which is very important for the muscles as well as for the bones, because we know pretty well as you get older the bone gets very much into the osteoporosis. So we need to strengthen our bones. How we can do it? What are the exercises and fitness program you advise for strength training which a woman should benefit at the age of menopause?
Strength training is not just for athletes, it's essential for every woman after 40. During menopause, estrogen levels drops, leading to bone density loss and slower metabolism. Simple resistant exercises like body weight squats, wall push-ups, light dumbbell workout, or resistant bands help rebuild bone strength, prevent osteoporosis, and maintain a healthy weight. Even 2 to 3 sessions a week can make a big difference.
So, how you suggest? So, some people cannot afford to go for the gym. So, what is the simple things that you will advise in a practical way to many of the women? Because many of the when I say to my patient, you have to do some strength training, they will ask me, doctor, I cannot go to the gym. I don't have any weights at home. If I have a weight at home, they will laugh at me. So, what is a simple thing that we can tell the patients to do the strength training in their home level in a setup? Because many of the patients are lower economic, they don't have much of all these facilities there. So, what is your simple advice related to it?
They can start with a 10 minutes walk twice a day or gradual stretching or light strength workouts. track progress weekly. They can celebrate every small winning. Consistency is more important than intensity. Their body adapts beautifully with steady work.
Yeah. So sometimes they say, Madam, I never exercised in my whole life. So, as you rightly pointed out, a small walking every day, that is a very important one that every woman should do. And also simple weights like I ask them to keep an 1 liter water bottle. I'll ask them 1 liter water bottle, your off in a water bottle, fill up, and do with that your dumbbells. That will be the best part to have as a weight. So I think that type of an exercise, I think we can suggest to the patients, right?
Yes, yes,
So,
ma'am.
as you rightly said, they should start as a smaller one and they should stay as a consistent, and that will help them to strengthen them, because many times they do for some time and they leave it. So, if they leave it, they will go once again for the loosening strength, and that is not always good. So, another thing is, many times the women have a problem with their sleep. So, I would like your input that will sleep gets improved with exercise, or they will say, Madam, I will feel very tired. I cannot work in the day if I go for a workout in the morning. So, what is your advice related to this? What is the pros and cons? Mm.
Exercise acts like a natural antidepressant. It releases endorphins, reducing mood swings, anxiety, and stress. Activities like yoga or evening walks calm the nervous system and improve sleep quality. Just 30 minutes of activity, daily activity can help women sleep better and wake more refreshed.
Yeah. So there are a lot of people who are workouts too much. So do you have anything related to over exercising? Because some people they will. I know one of my friend who started her marathon at the age of 40. My own classmate. She started very much in thing with a marathon at the age of 40, and exactly by another 3 years she had both the knee joints gone. So does over exercising for the weight gain is anything important, or after 50 that you should not do too much of exercising? What is your take on this?
It's actually myth. It's actually myth, like exercise causes tiredness or that after 50 weight gain is unavoidable. In truth, smart exercise maintains metabolism, builds lean muscle, and keeps energy high. Over exercising without recovery can be harmful, but the right balance of movement, rest, combined with the nutrition supports a healthy, strong body at any age.
Okay, so we would like to say that almost the diet, your exercise, everything should be together, and a very consistent way of doing things will help both in her resilience and the strength. So another one, what you see in that picture, that many of the women have the muscle loss, the protein loss. The sarcopenia is the very important one that every woman goes through. If you see the elderly, they will all have the sagging skins, and many times that is the most stressful point for many of the women. So, what is your advice for this sarcopenia? Because sometimes they may stoop, they may even have the stooping, they may have shortening, all these things because of these joint osteoporosis as well as the sarcopenia. So, how you can advise them to strengthen their muscle and to make this type of a loss, sarcopenia and muscle loss, to get muscle weakening to get improved?
Sarcopenia, muscle loss is common during menopause actually. To correct it, we should include protein-rich foods, as ma'am said, like we need to include like dal, eggs, tofu, nuts, lots of vegetables, meats and all. And combined with strength training, flexibility workout, stay hydrated and stretch each and every day. Muscles respond quickly when trained correctly, even after long gaps.
So even after long gaps, you can start doing that will regain the strength of the muscles, right?
Yes, exactly.
Okay, so even if someone is 70 who have lost like this and flabby like this, once they start doing it, they will definitely improve in their muscle strength. Am I right?
Yes, yes.
Yeah. So some of the tell me a few important exercise that women should do routinely in their life to stay reasonably fit. Tell me some simple exercise, or if you can demonstrate one or two exercise, a very important exercise for a few seconds, it will be good for many of the doctors here to demonstrate to the patients.
I could say like brisk walking for about 20 to 30 minutes, or simple squats or wall push-ups, which improves their strength, and then plank or a simple core hold, which improves their balance and back strengthening, and then stretching or yoga to improve their flexibility, and breathing exercises or meditation to calm down.
Okay. So, how much they should do every day or in a week? They'll ask doctor how much we should do. So, simple walking, squatting, wall pushes, and even plank, all these things we can tell them. But how many times they should do in a week, and what is the duration that they can do to have a healthy life?
We could say like in the morning they can take do it for 20. They can start up with 20 to 30 minutes in the beginning. As days goes on, they can improve the walking duration. The same goes with the strength training also. If they're able to start with the lesser weight like 2 kg, they can start with 10 repetition, and then after a month or 2 months, they can increase their weight and the repetitions.
Okay.
The gradual and consistency maintains.
Okay. So what the exercise that was given in the International Menopause Society, they have given a proper uh, points for the types of exercise that they should do as in the fact sheet. They say that endurance is made with the aerobic exercise, and also there should be a multi-component training which includes resistant exercise, for example, simple and a very small when in a young age, high intensity interval training or mixed routines, which provides a benefits for the vasomotor symptoms, inflammation and strength, flexibility and fat reduction. And in the menopausal stage, exercise and the MHT, they have given a lot of evidence that MHT can enhance the benefits of exercise on metabolism and vascular health. Over a long term, combining MHT with the aerobic exercise may help to maintain the arterial flexibility, but definitely findings are mixed. So they have given a lot of fact sheets about the exercise in the menopause day. They have given some fact sheets. They say that using weights, resistant bands, and doing yoga, as rightly pointed out by you, that will help to improve the muscle and also increase the muscle strength. So they have recommended like you have to do 150 to 300 minutes of moderate aerobic activity or 75 to 150 minutes of vigorous aerobic activity like each week, plus at least 2 days of resistant training. That's what the recommendations given by the International Menopause Society in their fact sheet. Ideally 150 minutes of moderate aerobic with 2 days of resistant and strength training should be educated to every woman. That will help them to keep a very healthy lifestyle. So thank you, Kani, for joining with us, and thank you so much. So the takeaway point, what you want to advise for all of us, just give me a few points to take away points.
Sure. Hydration, nutrition, and sleep are equal partners with exercise in lifelong health. To include, menopause is not the end of vitality, it's the beginning of wisdom and strength. With the right exercise and mindset, every woman can feel energetic, confident, and fit at any age. Thank you. Thank you for the
Thank you,
opportunity.
thank you. Thank you, Kani, for your nice interactions. Madam, over to you.
Yes. Sir. Good evening, sir.
Good evening, ma'am. Namaste.
Namaste, sir. We always have sleep disturbance is very, very cumbersome, and it is one of the most reported among menopausal women. What are the underlying reasons, sir?
Thank you, ma'am. First of all, thank you very much. This wonderful day, World Menopause Day. I thank Jairani ma'am and Deepa Tangamani ma'am, Hepzibah ma'am, all the leaders of the OXY and CMS, IMS. Thank you. So coming to the question. So during menopause, the main etiology behind the sleep problem due to the hormonal changes. Hormonal changes in the sense declining of the ovarian function, mainly the estrogen and the progesterone. These two hormones are one of the protective hormone for several things, several activities. One of the activities is sleep. Sleep is a vital metabolic function, not the luxury thing. Sleep is a very important vital metabolic function For a good sleep, the hormone is a very, very important thing. So we have a sleep hormone called melatonin. For the good melatonin secretion during nighttime, the estrogen and progesterone plays a major role. So decline in the function of ovary and decline in the estrogen and progesterone hormone, which relatively leads to reduction of the melatonin hormone, which leads to menopausal insomnia. So we have a separate phenotype in female populations. So until the menopause, the sleep issues are more common in the men, mainly the sleep apnea. But after the menopause, you see the both incidents of the sleep disorders, mainly insomnia and sleep apnea, are the equal because of the hormones, mainly the progesterone and the estrogen. So this is the etiology behind menopausal insomnia. Is one of the common entity we come across. A lot of patients with the insomnia. So insomnia among these sleep disorders, insomnia is a very common sleep disorders we see in our practice. Yes, ma'am.
Can I have the next slide, Aditi? Sir, how does poor sleep impact hormone balance, mental health, and weight during menopause?
Yeah. So during menopausal, because of the hormonal deficiency, hormonal imbalances, the shift of the fat distribution into the neck area, which causes the loss of upper airway muscle tone, narrowing of the upper airway due to the loss of muscle tone, which leads to apnea, hypopnea. This is an important event occurring in the obstructive sleep apnea. Obstructive sleep apnea is the second most common sleep disorders we come across in men and women. So predominantly in a perimenopausal. So menopausal insomnia commonly associated, sometimes associated with the sleep apnea and insomnia, we call it as the COMISA, that is separate phenotype in female population. Combined or comorbid insomnia and sleep apnea, we call it as the COMISA. This we see in the female population is very common during a perimenopausal and postmenopausal because of the hormone changes, fat distributions, loss of upper muscle tone, and the hot flashes. There are so many vasomotor changes occurring because of the hormonal changes. Postmenopausal, we see a lot of things, and weight gain. Weight gain also one of the important thing. Estrogen and progesterone are one of the protective hormone. Protective hormone. If you have a good sleep, so you won't develop much metabolic syndrome like uncontrolled diabetes, uncontrolled hypertension, heart attack, stroke, atherogenesis, and all. So if you lack of the hormone, so which may lead to this kind of insomnia and sleep apnea.
So what lifestyle or bedtime changes can significantly improve sleep quality?
Yeah. Quality matters than quantity. So sleep quality, if you want to have a good sleep, we have to follow the sleep hygiene, sleep practices. That is a sleep discipline. So we have to follow the sleep schedule. You have to go to the bed correct time and wake up at the correct time. Example, night time, 10 p.m., maximum 11 p.m., you have to go for the sleep. Morning, you have to wake up 5 a.m. or 5:30, at least 6 o'clock. So 6 to 7 hours sleep is mandatory. So we have to follow the sleep schedule. Exercise is very important. Madam clearly told about that. Diet, exercise, sleep. These three are pillars of health. So any one deficiency in the form of the sleep deprivation or the insomnia or dietary changes or the exercise, it will affect your lifestyle diseases will come. Lot of metabolic syndrome because of these three: diet, exercise, and sleep. Tamil we say unavu, urakam, urapayirchi. So among three, sleep is a very, very important thing. So the lifestyle changes during sleep. We have to finish your light dinner 2 or 3 hours before your sleep. The example, if you're going to bed at 10 o'clock, you're going to bed at 10:30, you must finish your early light dinner 2-3 hours before. 7:30, 8 o'clock, you finish your dinner and do exercise in the evening or morning. Avoid the gadgets in the sleep room like a TV, WhatsApp, mobile, and iPad, and laptop. You must avoid all the things. Sleep room, it will be very calm, cool, and the darkness. This will be promoting your sleep, and certain foods will help in improving your sleep, and a lot of lifestyle changes, and avoid a very heavy diet before sleep. So these all things are very important, and the sleep hygiene, mainly the yoga, meditations, and the yoga nidra, and the meditations with the relaxation technique are very effective. Yes.
Sir, is there a natural remedies like herbal tea, melatonin, etc. for
Yes, madam. Yeah. For the good sleep, we have certain food substances like increased amino acid food, mainly tryptophan containing food like nuts, milk. If you don't have diabetic, you can take banana. So these kind of food stuff will have a more number of tryptophan amino acid. It secretes the melatonin in the brain region, so it will help in promoting a good sleep. And the avoidance of a heavy diet and avoidance of spicy diet, avoidance of the coffee, tea after the after 4 p.m. So these food substances will promote your good sleep. Melatonin, if you have any deficiency of melatonin, we can start once you follow all the sleep hygiene practices, sleep discipline, so still you have a problem. So we can prescribe the melatonin in the form of 2 milligram, 3 milligram, or 5 milligram. So we can have the long-term medications also with the melatonin. Yes.
So when should they seek a medical help?
Yeah.
Persistent.
Yeah. Got it. So medical evaluation to be done in a case of persistent insomnia. So if you try the sleep hygiene, if you try the all sleep discipline practices, if you try the cognitive behavior therapy, meditations, and the guided relaxations, yoga techniques, food techniques, exercise, and other, you still persistent insomnia, so you have to go for the insomnia evaluation, whether it's the primary or secondary. Secondary means secondary to example, in the case of asthma, we have a severe asthma, cough and breathing issues, wheezing kind of thing, causing disturbance in the sleep, causing insomnia. So you have to correct the basic disease. So if you have joint pain, arthritis, so you have to take a proper treatment for that. So likewise, secondary insomnia. For primary insomnia, the treatment starts with sleep hygiene, cognitive behavior therapy. So medical treatment at the end, we prescribe the some kind of sedative agent, sleeping pills, Zolpress, etc. We'll give at the last third part only, with the consultation, if necessary, with the consultation of the psychiatrist also.
What is your suggestion for the CEOs who work for a long time? What are the tips you can give for them?
Yeah, for the CEOs and a lot of multinational companies, we are working for the European and Americans. So we have a lot of sleep debt, sleep deprivations. We are working hard with that, earning money. A lot of computer software people, we are seeing a lot of premature diseases. So sleep means mainly the nocturnal sleep, nighttime sleep. In the nighttime sleep only, we have a sleep hormone, melatonin, released from the pineal gland in the pituitary in the brain. So daytime sleep is slightly difficult. So if you want to maintain a good sleep, you have to have good health, you have to have the nighttime sleep. Awareness of nap, if at all we want to have a short power nap, 20 minutes, you can have it in the afternoon after lunch and all. If you exceed more than 45 minutes, 1 hour, so it may affect your night sleep. So night sleep is very important. 6 to 8 hours, and adult sleep is paramount important for the good health.
Okay. What about this? Does it causes abdominal obesity? Average sleep 5.5 hours when the sleep duration is less.
Yeah. See, average the sleep duration as per the American Academy of Sleep Medicine in adult is the 7 hours. So 7 to 8 hours, 6 to 8 hours, and average 7 is the golden number. We have to have the good sleep 10 p.m. to 6 a.m. In the time is a good sleep for everybody. So some of the patients, some of the persons, they have a very short sleeper, 4 hours, 5 hours, they have enough. Some of them, they have 9 hours, 10 hours sleep, they have a long sleeper. So short sleeper, long sleeper, depends upon the phenotype. Not all the persons are same. So we are all practicing in an era of precision medicine. Each and every person, every patient is different. So we have to follow the individualized, personalized treatment. So one size does not fit for all. So each patient we have to suit accordingly. According to the person, we have to give. If you don't get proper sleep deprivation, insomnia, so patient put on the weight, and the weight causes a lot of fat distribution, which causes the sleep apnea, one of the important malignant disorder, malignant sleep disorders. So we have to have the effective treatment for sleep apnea. Among all the sleep disorders, insomnia, sleep apnea, restless leg syndrome, sleep apnea is one of the malignant disorders we have to treat effectively. Otherwise, it may lead to a lot of health consequences like a heart attack, stroke, cancer, and uncontrolled diabetes, uncontrolled hypertension, road traffic accidents. There are a lot of things because of the sleep apnea.
Okay. So, can this sleep pattern, what is the impact on circadian rhythm and sleep?
Yes, ma'am. Circadian rhythm or biological clock, this maintain the day and night. So daytime in the sunlight, so there is no secretions of melatonin. So in the nighttime, so we have a secretions of melatonin, sleep hormone, it induces sleep. So for that, we have to adjust and we have to follow all the circadian rhythm of pattern. So if you avoid the night sleep, so if you are sleeping in daytime means only you will sleep only 4 to 5 hours. This may not sufficient for your metabolic function, hormone imbalance, and all. So it may lead to a lot of metabolic diseases for which we have to follow the circadian rhythm clock is one of the important vital biological clock. We have to follow these kind of thing are very, very essential, man.
Is it safe for older people to have a melatonin, sir, for sleep disturbance?
Yes, madam. So in the older people, they may have the hormone imbalance like a progesterone, estrogen deficiency, which leads to decrease in secretions of melatonin because of so many etiologies. So persistent insomnia people, so we can supplement with the melatonin 3 milligram to start with, and we can step up with the 5 milligram. So long-term use of melatonin after the initial treatment with sleep hygiene, and sleep hygiene means mainly exercise, sleep schedule, avoidance of alcohol, coffee, tea after 4 p.m. So this kind of sleep schedule, sleep hygiene we have to follow, and cognitive behavioral therapy, yoga, meditation we have to follow. So despite patient is struggling, we can prescribe the melatonin long term. There is no major side effect from the melatonin now.
Sir, can I have the next slide? So you've already talked about the mental health and the metabolic health and its relation to sleep. Can you briefly tell us something about that?
Yes, ma'am. See, in a case of sleep apnea or insomnia or comorbid insomnia and sleep apnea, we commonly seen in a postmenopausal woman. So they have more, if the patient has sleep apnea, there is a reduction of oxygen in the lungs and a reduction of oxygen in the brain, which leads to hypoxic encephalopathy. It may lead to a lot of neurodegenerative diseases like these depression, anxiety, and the dementia, Alzheimer's disease, and all that. So for that, we need to have the proper sleep evaluation. Any patients with insomnia or sleep apnea, we have to evaluate by doing the sleep analysis and teach the patients about the sleep hygiene. If we take the sleep hygiene awareness properly, we must follow the sleep schedule, exercise, diet, all important. Awareness of gadgets during the sleep hours, all important. So these kind of sleep hygiene practices we tell, and awareness about the sleep apnea. So we are thinking in terms of snoring or daytime excessive sleepiness is normal. Some of the, if you ask any layman, you ask what about your take on snoring? They say, yeah, snoring means good health, good sleep. They tell like this. Snoring daily means we have to rule out obstructive sleep apnea, one of the common sleep disorders we come across as a respiratory physician, and insomnia is a very common disorder. So we have to tackle properly and do the sleep study and do the treatment properly, ma'am.
Okay, sir. Okay, actually, the sleep also related with cardiovascular health. According to American Heart Association, it is very essential. Poor sleep quality, very short or very long sleep are linked with the high risk for heart disease, stroke, and cardiovascular mortality. Sleep disorder breathing, such as sleep apnea, and Sir was telling so much about that, raises the risk of hypertension. And the key takeaway is the restorative sleep is vital for brain, heart, bone, and emotional health during and after menopause. As already mentioned, it is very, very vital. Unavu, urakam, and உடற்பயிற்சி. Poor sleep can worsen symptoms and raise the risk of chronic disease, but small daily habits from keeping a regular bedtime to limiting caffeine can significantly improve sleep quality. Investing a better sleep is one of the most powerful ways to support long-term health and well-being. These are all the things which is done by the International Menopause Society. Keep a consistent sleep schedule. Create a cool, dark, and quiet sleep environment. Sir was insisting on that. Limit screen time, blue light, caffeine, and alcohol before bed. Be active during the day to support better sleep at night. Eat and drink mindfully in the evening. Avoid large meals and cut down on fluids before bedtime. Skip late afternoon naps. If you struggle with ongoing insomnia, ask about cognitive behavior therapy for insomnia, the recommended first-line treatment of menopause. All these things were taught to us by our grandmas and mothers to drink milk, go to bed early, wake up early. All this we are repeating. Thank you so much, sir. It was a wonderful discussion.
Thank you very much. Thank you for the opportunity, madam. Thank you.
Thank you. Thank you, sir. Thank you for your nice deliberation. And thank you so much for all the tips and things which you really owe. And we, most of the gynecologists, we hardly sleep for 5.5, 6 hours, and all the way in between, we'll be waken up by emergencies. So definitely, we are good teachers and good speakers, but poor patients, sir. So as a gynecologist, I would like to say to our fraternity to make sure the sleep hygiene is very important, which we lack. We eat good health, we actively participate in all the activities, but our sleep pattern has to be regularized as sir's advice, especially the menopausal women. As
All,
we get old, we have to keep consistent time
all
of sleep.
doctors only advise, no, they don't
We,
practice.
Yes, ma'am. Yes, ma'am. Yes, ma'am. Anyway,
thank you,
thank
sir.
you.
Thank you
Thank
so
you.
much
Thank
for
you.
your kind presence. And we will move on to the next very important part of the menopause, that is the mental health, which is a very important pillar which comes into the women's menopausal health. I have the great pleasure in welcoming Dr. Shweta Raghavan. Madam, I would like to say that we know pretty well many women come at the age of 40, 45 with lot of mood swings and lot of anxieties, and many of the couple come with lot of conflicts. Doctor, till now she was very fine. Suddenly she started, with lot of issues that we have. So many a times, even a very good couple earlier will start to have a very different way of experiences. So mainly the mood swings, anxiety, and even depression, lot of conflicts which happens during this way. So how you can explain this of hormonal changes, and how and when to identify such couple to go for the treatment proper or a professional help?
Yes, ma'am. Good evening, ma'am. Thank you for the opportunity given. Thanks to the entire team. Ma'am, we all know even during our period time, that is prior to menstruation, 2, 3 days before, we all have our own mood changes. So we are well aware that estrogen and progesterone play a significant role in mood swings, causing anxiety and depression. So how to identify is if the person who is going through menopause consistently feels low or anxious throughout the day for more than 2 weeks, then technically speaking, it amounts to making a diagnosis towards an anxiety disorder or a depressive disorder, depending upon the predominance of symptoms of either category. So, at least 2 weeks of symptoms and most period throughout the day. So there might be days where they will feel good also. So everything does not come into a disorder conundrum. We need not make every other person who enters our room saying, okay, you have an anxiety disorder, we will not diagnose. It can be a simple adjustment issues where the body is still getting adjusted to a low level of estrogen and low level of progesterone. So the anxiety mood swings are going to happen if they are consistent throughout the day for most days, more than 2 weeks, then we can figure it out and then we can reach for professional.
Oh, as you pointed rightly out, that the imbalance of the estrogen, especially the estrogen lowering, has an impact on the serotonin. We all know the serotonin and the dopamine are the neurotransmitters which are there for the mood elevation, happiness, joy, feeling, and that has a suppression because many of these neural pathways have the receptors which is mainly triggered by the estrogen. So when there is a lowered estrogen, as you rightly pointed out, these receptors goes off and all the serotonin and dopamine goes off and the GABA goes off, and all these things has a lot of changes in their mood, and that is the reason that they go through it. Madam, is it a real biological or it is a psychological or social? So how much we can give it in that way? So because many times many women, that is mainly the biological we say, but it added upon by the psychological as well as the social. What is your take home in this way, that how the social and the psychological role play in this women along with their biological things?
So everything plays an equal role. We cannot say biology is higher, psychology is lower. So we all are biological beings living in a society which has its own psychological construct. So all the three play a mixture of role. We cannot separate saying, okay, biology is 70% while psychological and social role is very less. So they all play an equal role because see, now you said, ma'am, estrogen plays a very important role. Now our dietitian was speaking very clearly, the gut brain axis is the main target for mental health issues, not only related to menopause, but also any larger mental health issue, because serotonin is primarily 90%, more than 90% is produced in the gut. Only less than 10% is available in the CNS. So now our targets have moved away from just modifying CNS serotonin levels to gut-brain axis. We know there are so many people who are following Dr. Pal Manikam, who says, how do you modify the diet to identify, to make your mood better. So when we have, I think we all know there are sugar cravings during those menopause times. And when we are feeling low, we want to munch on chocolates. We do something called stress eating. So we are all very clear, and our age old fact where ஒருத்தர் மனசுல இடம் பிடிக்கணும்னா நல்ல சாப்பாடு போடுங்க. So you want to enter someone's heart, you go through a good diet. That's what our forefathers have explained to us. So there is a significant portion where, there is diet which plays a very important role. Psychology, yes, we know that Madam Dr. Ragini clearly put it out. There is empty nest syndrome. You are in your 50s, your children have left out. Maybe you have your spouse, you do not have your spouse. So those psychological problems also keep adding on to the biological issues. And in society, you have your body image issues coming with menopause. So the society also plays a role. So each one of it adds fuel to the fire. There is no one separate thing saying biology is more important where society is less important.
Yeah, ma'am. Thank you. Thank you for the nice explanation. Yes, we know all the both, everything plays a role. Nothing comes like nothing is hired to something. So all have an equal role in causing this women. So that's why they have a lot of issues. And many a times we come across women who are little obese in the menopause, has a lot of image issues related to their body images, and that is very difficult for them to accept. So as you rightly pointed out, each woman is different and everything play a role. So what is your message, or what is your impact, that how the family members or partners should know about it to take care of this women who goes through this emotional instability at this time? What is your advice, how you support and how you give your advice, madam, to the family and the partners?
Just again quoting Dr. Ragini, who said very clearly, your happiness is under your control. So if you leave the remote of your happiness to be handled by your family members, then you are constantly allowing them to manipulate your sense of fulfillment, contentment, enjoyment, and all these things. So for a person who is bestowed with a family, well and good. You can reach out to your family. You can say, my days are not good. And family members can, if they are well informed about what menopause is, then they can support. But let's assume a person who doesn't have a family, who stays alone, who is single, she is also going to go to menopause. So yes, partners can play a very, very important vital role, saying, okay, go for a walk with a partner, have a nice evening tea with a partner. What if you don't have a partner? What if you don't have a family member? I think in India now it is picking up that there are gated communities where you have, groups who meet in the evening. Like we all were discussing, there are yoga classes where you can find your friends. You need not actually have biological relatives to look up to. You can have social friends, which is more welcome because they are non-judgmental more so. Family members, on the other hand, because you meet them every day, they'll be like, you were fine yesterday. What is it happening today? You are having all the money, you are having all the luxury. Suddenly you're saying your mood is changing. So that's a bigger place where family is very often judgmental, while your social friends are less judgmental. So a person with family can have both pros and cons. The ideal would be learn to modify your choices so that you are not dependent too much on family members also. That's my takeaway. That's how I choose to work.
That's fantastic, ma'am. That's fantastic. That's really inspirational. So as we get older, it is always, but you have to look after yourself. Your mind is the key for your happiness. You are only responsible for your own happiness. That's very important. So we have to start training this right from the middle age, so that once you go through the menopause, you will have a lot of things for yourself, which you can make yourself happy about that, instead of being emotionally drained and depending on your partners or your friends. You have to have yourself. That's very important point, as you rightly said. So I would like to ask you, in your vast experience of handling such patients with either a PMS or mood swings of the menopause, what is the best practical tools will you advise for your patients when they come across with the problem? Doctor, I have a problem with the mood swings. I know pretty well that I'm going through menopause. What is the practical tips that you will give to make me mentally strong, or how you can keep my mindfulness in this way? What is the best thing that you will advise? Because most of them, they will have a lack of concentration, forgetfulness, everything will be creeping in this mind at this age. So what's the best tool that you will advise for your patients, which will be
Ma'am,
helpful for us to
yes.
tell them also? Yeah.
Quick tool that I choose to use is it will mix up everything. One is choose a 20-minute period where you can sit in the sunlight, do some yoga postures. So your sunlight, whatever D3 that you want for the diet is already there. Then in that 20 minutes, you can do some yoga postures, so flexibility is done. And in the same 20 minutes, you can choose something called, body scan, where you just close your eyes from head to foot, just thank all your body parts, saying, okay, whether I am sleeping, whether I am hungry, whether I am not giving it food, whether I am thirsty, all my cells continue to work tirelessly until the moment I breathe my last. So I should be the first person whom I should thank myself. This is called gratitude towards self. We all express gratitude to other people, to people who serve us coffee, to our chauffeurs, to all our assistants, to our juniors, and to any number of people, our family members who cook food for us, and so many other things. But the last person, I do this first for myself. Only if my body cooperates, I can be efficient, and only if I am efficient and I fall sick less often, do my family have to take care of me. So what I choose to do is a 20-minute time where sunlight is taken, yoga is done, and self gratitude, head to foot, thanking all the body parts because it works tirelessly through the day. And the last thing at night is, okay, thank you body, you have worked for me through the day. Hopefully we will get up tomorrow morning and work in unison, both the mind and the body. A sound mind is in a sound body. So if I don't have physical health, and then I'm sure then mental health is going to take a toll. When I'm having fever, I'm sure I'm not going to be happy. When I'm having a stomach pain, I'm not going to be happy. So both physical and mental well-being go together. So 20 minutes is the easiest thing that I tell. To the picture clearly showed journaling. So journaling is one thing where you're not expecting another person to listen to all your woes. Take a pencil, take a paper, write down. So if you have real anger towards someone, we would tell something like hate letter. Write a hate letter to that person with all the foul language that you want. Shred it into pieces, flush it down the drain. Your anger towards that person is flushed. Or you want to express happiness towards some person, write a love letter. If you can post it, well and good. If you can't post it, leave it hidden somewhere. So those are ways where you choose to express yourself without fear of being judged. So this is my personal diary. I can write whatever I choose to, and I keep it very safe.
Yeah, thank you. That's really motivational, madam, to know about all these things. And definitely, as you rightly said, your body is the one which you have to be happy about it, and you should be thankful about it, because that is the one which carries everything for you. Yeah, that's nice that you brought about the body, which is very important. And I would like to ask that, as a psychiatrist as well as a psychologist who work on this field, when you will suggest medications to this group of women, and what is the usual medicine that you give when you can't treat them with any of your tools? And they will ask for some medicines. Doctor, you give some medicines, I'm totally now out of my control. Or some, the husbands may say that she needs some medications. What is the medicine that you will advise? You will advise a hormone therapy of ours, or is there any other medicine that you will advise from your side?
Ma'am, again, this is mental health is like diabetes. There is no one-stop solution. So there are medications, there are lifestyle changes, and there is family support, all of which is required. Ideally, during this perimenopausal age group, due to the muscle hot flashes and muscle weakness and fatigue, desvenlafaxine is one of the preferred medications because it helps with all the hot flashes also. Maybe a low dose of clonazepam if sleep is a concern, and that too clonazepam only for 4 to 6 weeks, because beyond that, if they continues to use, then they become dependent on benzodiazepine. So, as Sir rightly said, melatonin is the first drug of choice for sleep issues. If there are hot flashes and muscle spasms, a lot of rigidity, lot of unexplained aches and pains, then desvenlafaxine is a preferable drug of choice.
Yeah, thank you, madam. So I would rather ask you that, of course, as a doctor or as a gynecologist, we will like to advise to the couple or to any of the partner when they have to bring them to our notice. What are the how we can identify the changes so that they can get the help?
Have some time, then there is a very easy tool called DASS. This is called DAS, which is Depression Anxiety Stress Scale. It is a 21 item freely available unpaid scale, which has 7 items each for depression, anxiety, and stress. They can be given when your patient is rightly sitting in your office waiting for their turn. They can score it, and the totals can be assessed by you whether it is mild, moderate, or severe depression, anxiety. If it is mild and moderate, then the lifestyle changes which sir suggested, including sleep hygiene, dietary modifications, including exercise and mindfulness, all these things mild can be managed. If it is moderate, then again CBT can be done, for which you need to refer to us or our team of psychologists. If it is severe, then we will have a mixture of both medication and cognitive behavior therapy. So the DAS scale can be easily administered. It need not be clinician administered. It's just a paper. Keep the paper printed. If there is a person, not only for menopause, any person sitting in your chamber waiting for their turn can use this as a general health questionnaire. It is called DASS. They can just score it and leave it. You can assess it later and then tell them, okay, looks like you are having mild to moderate level of depression or moderate to severe. If it is moderate to severe, please consider referring to a professional.
Yeah, thank you so much, Dr. Sweta, for giving a very lot of insights about the mental health issues that we face through, how to identify when to have the medical treatment, what is the best tool that they can do, and what are the treatment strategies that you can plan for them, and how they can be connected socially in a better way, and going through this journey of this mental health issues, what they face in the menopause. Thank you so much for giving your insights. And our international menopause uh, committee, they given a fact sheet about these stress management strategies. What they give is the mindfulness program, which is a very effective program in reducing the stress perceived and improving the symptoms and help in the management, and cognitive based therapy and relaxation techniques which improves the skills and lower the stress levels and reduce the vasomotor symptoms which they go through. And the art and music are the evidence shows they can reduce stress in all life strategies. There are very many research studies which proved that art and music, people have less menopausal symptoms. That's what they say. And the fact sheets conclude that the digital and mobile health, that is a very important point that they've seen over the COVID. In COVID-19 pandemic, the accelerated development and the use of the digital health tools, which can highly effective, which can has a great effect on the stress management. Systematic reviews have given that mental health approaches improve both psychological and physical outcomes, and effective tools include breathing exercise, muscle relaxation apps, meditation programs, and personalized digital guidance has been an effective tool in combating this mental health as in a menopausal women. And mental health definitely offers a promising, accessible, cost effective way to support stress self management while reducing the burden of the healthcare system. So many of the digital tools which helps for this women, instead of going to the medical field, they can have their own apps in the form of a breathing exercise relaxation app which comes through the media that helps them for improving the mental health. So I would like to ask the panel, madam, each one you can ask them one wrap up collective questions, one wrap up questions.
Question or answer?
So you can ask them the question, they'll answer, madam.
If
For all of them, each one of this question.
one next. golden rule for therapy. What is the golden rule to thrive menopause? What it would be? To whom it should be addressed?
For all, each of them can give one line, ma'am.
One answer.
Connection panna.
So, can I start?
Yeah.
Please.
Okay. So, the golden rule for menopause is ensure that you maintain weight. As I told, limit sugars, saturated fats, and salt. This will help you to maintain good health and a better weight.
Can I have the next slide? How can a gynecologist collaborate across your disciplines to create more holistic menopause care model?
Can I answer that?
Can a sports person can answer this? Not. Sir, can you tell us, sir, something about holistic approach? When
Yes,
a lady
yes,
comes to
ma'am.
us?
Yeah, madam. See, during menopause, perimenopausal or postmenopausal, we're all seeing a more number of cases of insomnia because of the hormone imbalance, melatonin deficiency, and all. So, insomnia is a very common problem. Day-to-day practice postmenopausal very, very common. Along with sleep apnea, it's the second most common sleep disorders we come across in our practice. So, any insomnia or sleep apnea, these two are very common postmenopausal. You have to take care effectively to avoid unnecessary complications from insomnia and sleep apnea. So diet, exercise, sleep are important pivotal role to play a maintaining a good health. So an average adult 6 to 8 hours sleep hygiene, regular sleep schedule, and exercise and the diet, and the 2 to 3 hours before the sleep you have to finish your dinner, and the avoidance of all electronic gadgets, sleep room to be a calm and cool and dark. So these are all things very important. Any sleep issues, so consult properly, and if necessary, we do the sleep study to come across to find out the sleep disorder breathing to prevent unnecessary morbidity and mortality. We have effective medications. Only thing is awareness is the key. So insomnia, sleep apnea needs a proper treatment to have a very good, happy, healthy life. Yes.
Thank you. Thank you, sir. So, what is your take on this when a patient is silently struggling through menopause?
Shall I answer that, ma'am?
Yes, please.
So the first thing is you are not alone. All of us are in different stages of life where we go through menopause. So we are here to help. Have the confidence. Start moving ahead. Reach out to the person without any stigma, because reaching out to us is the biggest thing. As a psychiatrist that I have been practicing for 15 years, reaching out is very difficult. So if I enter a psychiatrist or a psychologist chamber, I have the stigma saying, do I have a mental health issue? I'm like, you don't have to have a mental health issue. Can we discuss? Is this normal to have mood swing during menopause? Is it normal to have crying spells? Is it okay to cry even if I don't have a reason? Yes, you don't have. You can just enter our chamber, discuss. We are available to provide mental health help. And there are so many groups where you can talk anonymously without the fear of being judged if you can't reach out or can't afford a mental health professional. So that support we are willing to give. So you are not alone in this. We'll help you through this.
Yeah.
Thank you. So I think all our experts have given a very good insight about each and every aspect of the lifestyle medicine, which is the theme of this year, International Women's Day. So this theme is definitely a very important theme because it has a holistic focus. Many of the past themes have talked about the symptoms of and the therapies, but this is something which gives a broader view and which gives a woman and a woman as a whole person, which can give a lot of insights into the preventive aspects and empowering aspects, accessible one, and also to support your own self. So in that way, the lifestyle changes can prevent or lessen many of the chronic disease and the complications that risk increases after the menopause, like heart disease, diabetes, osteoporosis, as pointed out by the dietitian, exercise, as fitness specialist, and with the other psychologists. All these have a preventive power, and it has an empowerment over dependency, because it is not a women alone. It is always have, she need not depend on the medication, she need not depend on the persons, she did not depend on the family, but she has her own choices, which makes her empowered instead of the dependency. And it's also very simple to access the cost of the treatment process, and also the supporting transitions, which are very important. By these lifestyle habits, when we can adopt, we can have a better quality of life, and we can go through the menopause in a very niceful journey. Especially this journey will be made very graceful and pleasant, without the stress of the lot of myths that you have related to the night flashes, pain, joint pain, aches. All this can be corrected by this lifestyle medicines. So this year theme is a holistic focus, and I thank all my panelist experts for joining us to give their experts views on various aspects of this lifestyle medicine for the women's health, menopausal health. And I very special thanks to my moderator, Madam Dr. Hepzibah Madam, for joining with me and making this. Thank you so much, all the panelists and my madam. And we are happy to have with us our president, Indian Menopause Society President, Dr. Anita Shah Madam. Madam, we welcome you. Sahiti, can I have
Jayarani, just
Yes,
I have
ma'am.
listened the whole webinar. The whole discussion was unique and really very happy. But I was traveling from Delhi airport to Gurgaon, so I was on the way.
I know, ma'am.
And I couldn't speak in between. But very happy that World Menopause Day is celebrated in such a lovely way. You have so much nice discussion that we can fulfill the slogan of Indian Menopause Society, that is fit at 40, strong at 60, independent at 80, and the which I have elaborated to a more lovely extent. Fit at 40, fancy at 50, strong at 60, sexy at 70, independent at 80, naughty at 90, and healthy at 100. We want that each and every midlife woman should remain healthy and happy. And what the pillars you have discussed, they are really very, very important. And so that our midlife woman can remain healthy and happy till the later age of her life. So thank you very much. Thanks a lot, Dr. Jaya Rani, Dr. Hepzibah, and the whole team for inviting me over here. And I listened the whole discussion. It was really, really very informative, and all the panelists have given the very, very important, crisp messages. Thank you very much.
Thank you, ma'am. Thank you, ma'am. Thank you for joining us in midst of your busy schedule. And really, we feel very happy to have you. And I have a very important message from the World Association Sexual Health President, Dr. Faisal, because he has a very important family member funeral. So he could not
Oh,
get the network there. Yeah, he's in Lebanon, madam. He's in Lebanon.
okay.
He's a very family important person. Funeral, suddenly he has to go, and it's an unexpected. So he has given a sorry message, and he could not even connect from there. That's a
Okay,
very
okay.
sad point of his, because that I got only in the late afternoon. So I was even asking him, can we flexible the time? He said, you keep going ahead. I'll try to join, but he could not join because he's held up in the funeral. So, madam, it's good that you have joined in midst of your busy schedule. And
Yeah.
on behalf of our Chennai Menopause Society and our OXSI, Obstetric Gynec Society of Southern India, all our
Yeah, yeah.
presidents, Dr. Premlata Madam, Dr. Sampath Kumari, Dr. Meena, Dr. Deepa, all are here. We have the great pleasure to have you here, Madam. And your treasurer in the Indian Menopause Society, Treasurer Hepzibah Madam, on behalf of everyone, we we give your heartfelt thanks to you, the guest of honor, Dr.
Thank
Anita Shah Madam, Dr. Ragini Agarwal Madam, by being there for the whole way, and a very, very important uh, presence. Your presence means a lot, and it is very inspirational for all of us. Thank you so much for being with us. And I thank all the senior faculties, Dr. Shweta, Dr. Daphne, Dr. Jayaraman sir, Dr. Kani, for sharing their their valued experiences, expert knowledge of sharing about the menopause. And definitely this year theme, that we are very much happy to have this theme, because it is very much instrumental in creating a women's life in a more positive way during the menopause. I thank you one and all. I thank the delegates who joined in many number all through the country, and a very special thanks to Sahiti from Shield for giving us the platform and coordinating in the beautiful way. I thank you one and all for your presence, and also I thank everyone. Thank you so much. Jai Hind.
Thank you.
Okay, Anita.